right, so we have a 44-year-old woman who presents to the emergency department with 1 week of crampy abdominal pain that is worse after she eats. She denies alcohol consumption or tobacco use. On physical exam, she is overweight and has epigastric and right upper quadrant abdominal tenderness to palpation. Which of the following examination findings is most consistent with cholecystitis? All right, so this question, we're given a bunch of clinical information, and then at the very end in the lead-in, we're actually told that the patient has cholecystitis. So we're in a very good position to start off this question. What we need to know for this question, however, is an exam finding that's consistent with cholecystitis. So we have to identify what is a classic presentation for cholecystitis on your exam. So let's go through the answer choices, and they are A, epigastric rebound tenderness, B, gray Turner sign, C, inspiratory arrest with right upper quadrant palpation, and D, right scapular tenderness. All right, so let's start looking at answer choice A, epigastric rebound tenderness. So whenever I hear rebound tenderness, I think about peritonitis. And certainly you could get peritonitis with gallbladder disease, right? With cholecystitis as well. Let's put this on hold, see if there's a better answer choice because it's pretty non-specific. It's possible, but less likely, not classic. All right, answer choice B, gray Turner sign. So gray Turner sign is classically associated with hemorrhage or ecchymosis of the flank. And you'll see this, classically with hemorrhagic pancreatitis. Rare condition these days, but it used to be a little more prevalent. But this patient does not have pancreatitis. You could also see this with any retroperitoneal hemorrhage. But in cholecystitis, that's not what we're going to see. So I'm going to cross off gray Turner sign. And answer choice C, inspiratory arrests with right upper quadrant palpation. This certainly sounds like it's consistent with cholecystitis, specifically with Murphy sign. So let's just hold this one and we'll come right back to it. And then right scapular tenderness, answer choice D. Well, we know that cholecystitis is associated with right scapular something, right? And it's really referred pain. And the reason why you get referred pain in acute cholecystitis is because the gallbladder is irritating the diaphragm, and that is causing the phrenic nerve to become irritated in a sense, right? And cause referred pain to the right scapular region. So the shoulder could also be involved as well. But in this case, we're not talking about that symptom is referred pain. In this case, the answer choice is tenderness, which is not the case. So I'm going to cross off answer choice D. Now we're left with two, epigastric rebound tenderness, answer choice A, and C, inspiratory arrest with right upper quadrant palpation. Well, the classic finding is Murphy sign with acute cholecystitis. And Murphy sign, what happens is you ask the patient to inspire, right, to take a deep inspiration. And while the patient is inspiring, you palpate the right upper quadrant, and the patient will kind of take an inspiratory pause or will stop breathing and sometimes say, ow. And that's because when the patient's taking inspiration, the diaphragm is moving downwards or caudally or towards the patient's feet, and it's pushing the liver and gallbladder down. And so when you're palpating that region during inspiration, you make contact with an inflamed gallbladder, and ultimately will cause the patient pain. And because of the pain, the patient stops taking a breath. So that is Murphy sign. And this is exactly what answer choice C is describing. So let's cross out answer choice A, epigastric rebound tenderness, which is most consistent with peritonitis, which is really non-specific. And that will leave us with answer choice C. And sure enough, that is the correct answer. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh, signing off.